This is a report by Save Africa on the situation of Jiggers in Kenya as at 2023 September. In 2023, according to the estimation from the Ministry of Health in Kenya, approximately 2 million inhabitants suffer from Jiggers infestation and 10 million are at the risk of being infected. The Ministry of Health has warned that over 10 million Kenyans are at the risk of Jiggers infestation if no efforts are made to eradicate the parasite. It is thought that the Jiggers parasite, or the Tunga penetrans, originated from Central and Southern America and was inadvertently brought by humans to sub-Saharan Africa. Its symptoms include severe inflammation, ulcerations, and itchings, but if ignored, it could lead to tetanus, gangrene, and even loss of limbs. However, despite the alarming list of painful symptoms, it is surprisingly easy to treat. Prevention, which is often found to be more cost-effective than medical treatment, involves the education of communities on how to protect themselves against the parasite. Treatment includes bathing the patient's foot in a solution and possibly in more severe cases, the surgical removal of the parasite. Yeah, I'm holding a surgical blade. We're about to use this. We're going to be getting the jiggers out using this. But come a little closer. We have a few kids here, about 20 kids in this first center that we are in. We'll go to more centers. This is just one of the homes. We asked the neighbors to bring together a few kids who are really affected by this, and you can see the turnout. So we are going step by step, child by child, face by face. So come close and look at these children. These children are completely, apart from jiggers, you can notice that they are malnutrition. They have not been eating for a while. In fact, they don't know where the parents are because we just had to go to where they live, and they have been found alone. They live alone. And, the mother just goes to work and goes to look for food. They have no father. Jiggers infestation is not only painful, it can also cause disability, preventing many of those infected from walking and hence carrying out their daily activities. Furthermore, it is extremely detrimental for students whose only means of getting to school is to walk. Infected children and adults cannot work or earn an income from their household and are often discriminated against in their communities. This parasite was thought to be a thing of the past. Even today, over 2.6 million rural community members are living with the infection in Western Kenya and especially in Trans Nzoia. This will continue to be a problem unless precise action is taken. Save Africa's primary objective, with the support of the Ministry of Health through community volunteers, along with the generous donation of friends and partners, is to treat at least 3,000 who have been affected by the parasite and who are likely to receive the necessary treatment otherwise. Throughout the campaign, treatment centers are set up in neighboring public facilities, especially churches around. The total number of children who have been treated so far reaching a staggering 1,200, beating the original target by over 10%. This was hugely beneficial to school-going kids and extremely poor families. Mud walls and floors in homes and schools with a high student population density increase the likelihood of infection. Additionally, schools are where children from different backgrounds meet with the children who were treated. Save Africa counselors and community health workers also proved crucial in the exercise, as the counselors offered psychological support to the children who were infected and isolated or rejected by both their peers and family. Very softly, it's like it's normal when we have food on our table, when we have health, when we are okay. But these are about 12 students, young people that we're dealing with right now. And after this, we're going to deal with more. We're just beginning with this lot here. Come close, just come down. During the one-year implementation of the project, Save Africa has conducted 61 advocacy days, reaching an average of 135 people per event. The topic covered during these assemblies ranged from personal hygiene and environmental hygiene, covering all the way in which these people could improve their lives through simple behavioral changes. The third campaign was the routine house-to-house follow-up checks, which were used to establish the maintenance and progress of the Jiggers eradication program. Save Africa staff, together with community health volunteers, played a key role in this policy. Where children were treated without concrete follow-ups, reinfection was likely to take place. The campaign at household level allowed individuals to gain personal help and support where they needed it. So far, 12 households were closely monitored, and the feedback indicated that the campaign had made an enormous impact with no cases of reinfection. The treatment of 3,000 children is just one of the major benefits of this community. The treated children can now re-immerse themselves back into their education, creating brighter futures for both them and their community, as with education comes innovation. The treated adults, previously unable to work due to the disabling nature of the condition, will now be able to provide an income for their families. The improved knowledge of general hygiene within the community should prevent more common diseases and should also increase the overall health and well-being of the community. The children have developed confidence in protecting their own hygiene, which leads to improved self-esteem. There has been a noted improved psychological health and well-being among the affected. The campaign shows that effective elimination of disease is possible through the hard work of individuals and local people. Once again, we are thankful to every friend and partner that has provided us with the grants and the donations to be able to carry out the work necessary. Lastly, poverty and poor hygiene are the major causes of jiggers. To completely eradicate jiggers, Save Africa has undertaken to build more permanent houses for the most affected. This initiative includes identifying those extremely infected by jiggers, sourcing for funding, and finally constructing permanent or semi-permanent houses, especially for the families in mud walls and floors. So far, we have built one house. We are appealing to partners to help us achieve our target of 10 houses a year. If you would like to be of support to our Jiggers eradication program, you can make a donation to Save Africa through M-Pesa paybill number 4075895. The account will be Save Africa Jiggers Campaign. You can also get in touch with us on WhatsApp at +254 706 861 071. If this is an option that does not apply to you, you can also get in touch with us at dimbagaya@gmail.com. We're looking forward to partnering with you to save Africa and a family at a time. Remember, Africa is our business. Shalom.